family member. I've got a 21-year-old son who has autism and learning disabilities. And also within the extended family, I've got a cousin in his 50s who uses learning disability services. The care and treatment reviews, there's a team of a commissioner, a clinical advisor and an expert, and it's about reviewing the evidence, meeting the individual, talking to families. But part of that is everyone being equal in that team, and because they do have different skills. So it's not about protecting the expert, whether it be families or person with a learning disability, from some of the evidence. It's about being equal and part of that team. So as a family member, I think the main purpose of an expert really is to ensure that the person is seen as a person as part of this review, and it's not just a set of paperwork and diagnosis. The person's probably in the unit or the hospital because they've been sectioned or the courts have sent them there. They're quite possibly a long way from family, possibly don't have much family or friends contact as well. So it's a matter of making sure that we see the person and that they have a chance to have their say, and that their family has a chance to have their say as well. Part of the role of myself as an expert, as I say, is to ensure that we see the individual and not the paperwork. And so to that end, for instance, I'm very interested in are people having person-centred type plans around discharge. I try and avoid people being quite medical in the discussion, so I don't like talking about patients, I like talking about people, and the individuals. So going forward, I think care and treatment reviews are very important. It's a matter of focusing on the individual on a regular basis and not forgetting about them. There are figures about people being in hospitals for a very long time and not really getting appropriate treatment, and no one really thinking about discharge planning. And the care and treatment reviews, if done regularly, will sort of focus everyone's minds on how we help this person and how we get them back into their local communities, and that's very, very important.